If you are preparing for SPLE, MOH, HAAD, DHA or some other foreign exams, then this video is for you. In this video, we will discuss important MCQs about pharmacy and foreign pharmacist licensing exam. Number 1. Which of the following is a beta-lactamase inhibitor? Option A. Clevolanic acid. Option B. Azithromycin. Option C. Ceftriaxone. And option D. Vancomycin. Correct answer is clevolanic acid. Clevolanic acid is combined with beta-lactam antibiotics like amoxicillin to inhibit beta-lactamase enzymes produced by resistant bacteria. Number 2. Which anti-diabetic medication belongs to the class of sodium glucose cotransporter 2 inhibitors? Option A. Metformin. Option B. Glimepiride. Option C. Empagliflozin. And option D. Acarbose. The correct option is empagliflozin. Empagliflozin inhibits SGLT2 in the kidneys, reducing glucose reabsorption and promoting its excretion in urine. Number 3. Which medication is used to treat opioid addiction and also has analgesic properties? Option A. Naloxone. Option B. Buprenorphine. Option C. Methadone. And option D. Tramadol. The correct answer is methadone. Methadone is a long-acting opioid agonist used for opioid substitution therapy and pain management. Number 4. What is the mechanism of action of allopurinol in treating gout? Option A. Enhancing uric acid excretion. Option B. Reducing inflammation. Option C. Inhibiting xanthine oxidase. And option D. Binding to uric acid. Correct option is inhibiting xanthine oxidase. Allopurinol inhibits xanthine oxidase, reducing uric acid production and preventing gout attacks. Number 5. Which drug is used for emergency contraception? Option A. Ethinyl estradiol. Option B. Levonorgestrel. Option C. Mifepristone. And option D. Clomiphene. Correct option is levonorgestrel. Levonorgestrel, taken in high doses within 72 hours of unprotected intercourse, prevents ovulation of fertilization. Number 6. What is the primary therapeutic use of amiodarone? Option A. Hypertension. Option B. Arrhythmias. Option C. Heart failure. And option D. Hyperlipidemia. Correct answer is arrhythmias. Amiodarone is a class 3 antiarrhythmic drug used to treat both atrial and ventricular arrhythmias. Number 7. Which of the following medications is a monoclonal antibody used for rheumatoid arthritis? Option A. Methotrexate. Option B. Etanercept. Option C. Infliximab. And option D. Leflunomide. Correct answer is infliximab. Infliximab is a TNF-alpha inhibitor that reduces inflammation in autoimmune conditions like rheumatoid arthritis. Number 8. Which vitamin deficiency leads to pernicious anemia? Option A. Vitamin B1. Option B. Vitamin B6. Option C. Vitamin B12. And option D. Vitamin C. Correct option is vitamin B12. Pernicious anemia occurs due to vitamin B12 deficiency, often caused by impaired absorption related to intrinsic factor deficiency. Number 9. Which medication is used to treat Parkinson's disease by increasing dopamine levels? Option A. Donepezil. Option B. Levodopa. Option C. Rivastigmine. And option D. Carbamazepine. Correct option is levodopa. Levodopa is converted to dopamine in the brain, helping alleviate motor symptoms of the Parkinson's disease. Number 10. Which of the following is an H1 receptor antagonist used to treat allergic rhinitis? Option A. Loratadine. Option B. Ranitidine. Option C. Montelukast. And option D. Salmeterol. Correct option is Loratadine. Loratadine is a second-generation antihistamine that blocks H1 receptors, reducing symptoms like sneezing and nasal congestion in allergies.